Doing good with Share Charlotte. Tonight, we put the focus on the air we breathe. And while it may sound odd to some, that air we all take in is not equal. It's not the same in every neighborhood. It's because the environments we live in can be very different.
You know, environmentalism is not just about saving trees, it's not just about recycling. There is a real socioeconomic, systemic impact of how environmental issues affect people.
We're seeing lower quality of life, we're seeing lower life expectancy being decreased, maternal infant child health is being affected as well. We're having a lot of just pervasive air quality issues in those communities. Asthma rates are higher.
Crystal Dixon there is associate professor at Wake Forest. She focuses on environment and sustainability. She's also a board chair with CleanAIRE NC. Daisha Wall, who you heard from there first, is that nonprofit's director of programs. Now, you heard them mention systemic impacts and lower quality of life in specific neighborhoods. Neighborhoods largely home to black and brown people. Let me give you one example of just the kinds of things that they are talking about here. These maps that you see here behind me, they're from the Charlotte-Mecklenburg Quality of Life Explorer. And what we've done here is we've highlighted this area from West Charlotte near the airport up around the uptown to Northeast Charlotte. About 65% of the people who live in this stretch are black. That's more than twice the county average. So now we switch here to show the tree canopy in this area. Countywide, more than half of our land area is covered by trees. But again, this area right here from West to East Charlotte, 34%. Now, I want you to look at babies born with low birth weight. It is about 10% countywide. Quite a bit higher, though, in this area. It is up to 15%. And one more I want to show you here. Age of death. That's 72 countywide. But it's 5 years younger, 67 in the swath that we've highlighted. Now, it's not just because of trees, but it is a symptom of a larger problem. CleanAIRE NC is trying to highlight it through advocacy and education. And it starts with data, the kind they are collecting through sensors, not just in Charlotte, but across the state.
So we are measuring particle pollution, also known as particulate matter.
It's the stuff in our air, the pollution that is so small you can't see it.
So because they're so fine, they get into our bloodstream and they get into our bodies, our brains, etc., and they're not removed.
And those particles often float about in neighborhoods trampled by unhealthy public policy.
So I often say your zip code is a bigger predictor of your outcome than your genetic code.
Dixon says you only need to look where highways were knifed through neighborhoods, where industrial plants and landfills were put next to schools and homes.
It's a historical, systemic, pervasive issue across the country that affects typically low-income black and brown indigenous communities that are not in power enough to advocate for equity. And what's interesting about that, Jamie, is that even when your air quality drops, your wealth drops as far as your housing. All the things are lined up. Your property values are decreasing, your educational quality is decreasing, and your air quality is decreasing.
When you talk about the inequities and the policies and the problems that have been created by this, do you feel like that is starting to sink in, that people are beginning to understand it better?
The climate we're in right now politically, it's not making the job any easier. But I do think that there is an understanding when you're starting to see data show that as you know, heat rises, heat strokes are increasing, you know, CO2, PM 2.5 is going up, you're having a lot of asthma attacks happening. You're having a lot of, and they're starting to connect the dots there.
And connecting those dots takes that data being collected. It makes the impacts even harder to refute.
We'll never tell a community what they need to do with their data. We'll definitely encourage and support and provide resources around that avenue. So here in Charlotte, and we actually started our community science programming, our monitoring program here in Charlotte in the historic West End. And we were monitoring there for about a year. And after we collected a year's worth of data, we created a report with the community, and the community brought that report to the Board of Commissioners. And from that meeting, they were able to advocate for a federal EPA air monitor, which is now located within the community.
But I think people are probably watching and they're thinking, well, how do we reverse this? We can't let these people continue to live like this. Well, how do we fix it?
So that is such a hard thing to answer just because the impacts are so historical and so vast. So we really need to focus on resiliency and providing resources, tools, support for communities to be able to manage the impacts.
It's important work, and if you'd like to help their efforts by maybe making a donation, or if you just want to learn more about everything that they do, just head to CleanAIRNC.org.